How do eye doctors accurately diagnose uveitis? Imagine your eye as a busy city with many different parts working together. When there's inflammation inside the eye, called uveitis, it can be tricky to spot without a detailed investigation. Eye doctors use a combination of careful examinations, special tests, and patient history to find out what's going on. The first step is a thorough exam using a slit lamp microscope. This device shines a focused light into your eye, allowing the doctor to see inside clearly. They look for signs of inflammation, such as inflammatory cells or protein in the eye's fluid, especially in the front part called the aqueous humor. To get a better view of the back of the eye, your pupils are dilated with drops, which helps the doctor see the retina and blood vessels more clearly. They also check how well you see at different distances and test your peripheral vision to see if any side vision is lost, which can suggest retinal involvement. Measuring eye pressure is important too because uveitis can increase pressure inside the eye, raising the risk of glaucoma. Sometimes, the doctor uses a special technique called gonioscopy to examine the drainage angle of the eye, especially if glaucoma is suspected. During the exam, the doctor looks for specific signs like inflammatory cells and protein in the eye fluid, which are common in anterior uveitis. For more complex cases, they check for vitreous cells or snowballs, which are clumps of inflammatory cells, or snowbanking, which are inflammatory deposits near the retina. They also look for signs of retinal blood vessel inflammation or retinitis. To measure how severe the inflammation is, doctors often use grading scales that help track changes over time. Imaging tests are very helpful in confirming what's happening inside the eye. Fluorescein angiography involves injecting a safe dye into your bloodstream, which highlights blood vessels in the eye and reveals any inflammation or damage. Optical coherence tomography, or OCTOBR, provides detailed cross-sectional images of the retina, showing swelling or structural changes. If the view inside the eye is blocked by dense inflammation or cataracts, ultrasound imaging can help visualize the eye's interior. In addition to eye tests, blood work is often ordered to look for underlying causes. These tests can include a complete blood count, metabolic panels, and specific tests for infections like syphilis, tuberculosis, or markers of autoimmune diseases. Sometimes, a chest X-ray or other scans are done to check for systemic conditions like sarcoidosis or tuberculosis that could be linked to uveitis. The choice of tests depends on the type of uveitis, your symptoms, medical history, and where you live, since some infections are more common in certain regions. Your doctor will also ask about recent infections, injuries, medications, and family history of autoimmune diseases. This helps them understand if there might be an underlying systemic condition causing the eye inflammation. If they suspect a systemic disease, they may refer you to specialists like rheumatologists or infectious disease doctors for further testing and management. In summary, diagnosing uveitis accurately involves a careful combination of eye examinations, imaging, blood tests, and detailed medical history. This comprehensive approach helps confirm the presence of intraocular inflammation, determine the specific type of uveitis, and identify any underlying causes. Proper diagnosis is essential for guiding treatment and preventing serious complications like vision loss or glaucoma. Always remember, if you experience symptoms like eye redness, pain, or vision changes, consult an eye care professional promptly for personalized evaluation and care.